I feel very excited today because we will present you one of the most interesting topics. Today we will talk about time. We will talk about time and health as two components closely related to each other. Based on time, which we make different plans, especially when it comes to the time we sleep, we eat, or even do exercises, where each of them changes its performance at a certain time. For each category, we will try to explain when is the right time to perform the right activity starting from the sleeping time. The internal mechanisms that regulate our almost constantly endless cycles of sleep and wakefulness make up a wonderful system. However, a number of internal external factors can dramatically affect the balance of the sleep arousal system. Changes in brain structure and function during development can have profound, if gradual, effects on sleep patterns. The amount of sleep we get in general decreases and becomes more fragmented throughout our lives. These and other age-related changes are involved in the length of the essay. Changes in sleep with age. Other factors that affect sleep include stress and medical conditions, especially those that can cause chronic pain or other discomfort. External factors such as we eat or we drink, the other things, and the environment which to increase the number of awakenings and limit in the depth of sleep. Exposure to light can cause our biological clock to progress or delay, which affects to our sleep and wake cycle. Light is one of the most important external factors that can affect sleep, if does both directly, making it difficult for people to fall asleep, and indirectly affecting our internal clock and thus affecting one of our favorite times to sleep. Light affects our clock time internal through special light, such as light-sensitive cells in the retina of our eyes. These cells will occupy the same space as the rod and cones that make viewing possible. Tell the brain wherever is the day or night, and our sleep patterns are determined. You may feel sleepy during the day, but losing even an hour of sleep can affect your ability to think properly and respond quickly. It also compromises your cardiovascular health, energy balance, and ability to fight infections. How many hours of sleep do you need? While sleep requirements vary slightly from person to person, most healthy adults need between 7 to 9 hours to sleep per night to function at their best. Children and teens need even more, and despite the notion that our sleep needs decrease with age, most older people still need at least 7 hours to sleep, since older adults often have trouble sleeping this long at night. Daytime naps can help fill into the gap. Think 6 hours of sleep is enough? Think again. Researchers at the University of California, San Francisco discovered that some people have a gene that enables them to function well on 6 hours of sleep at night. This gene, however, is the rare, appearing in less than 3% of our population. For the other 97% of people, 6 hours doesn't come close to counting. The time required for sleeping is dependent on the age. We see for newborns and up to those 3 months, the time required for sleep is 14 to 17 hours, the minimum course, and the maximum is from 11 to 19 hours. And for the elderly, it goes from 7 to 8 hours, and the limit is from 8 to 9 hours. Your body clock, metabolism, and digestion interact in complex ways, meaning it's not just the way you eat, but when you eat, that matters. When young adults start university, they often gain weight. In the United States, they have a name for this phenomenon. They call it freshman 15, referring to the 15 lbs typically occurred during the student's first year of living away from home. In part, this weight gain can be explained by the substitution of home-cooked meals for ready meals and fast food, combined with a reduction in physical activity. However, scientists are fingering an additional suspect: circadian disruption brought about by a culture of late-night eating, drinking, and insouciant sleep patterns. For decades, we've been told that the weight gain together with associated diseases such as type 2 diabetes and heart disease are a simple matter of quantity and type of food we consume, balanced with the number of calories we expend through exercise. But mounting evidence suggests that timing is also important. It's not just the way you eat, but when you eat that matters. The idea that our response to food varies at different times of the day, back along with best tips for breakfast, eating within 30 minutes of waking up. The best time to have breakfast is 7 a.m. Do not delay breakfast later than 10 a.m. Make sure you have protein in your breakfast. Lunch. The best time to have lunch is around 1 o'clock. Try and keep a gap of 4 hours between your breakfast and lunch. Do not delay lunch later than 4 p.m. Dinner. About dinner, the best time to have dinner is before 7 p.m. You should keep a gap of 3 hours between your dinner and bedtime. Do not delay dinner later than 10 p.m. Eating close to bedtime can interfere with the quality of sleep. Finding time to exercise is really a challenge for many people. Exercise is important, but everyone also has lived with jobs, families, significance, friends, household duties, runs, and the need for the rest and sleep. Where does exercise fit in, then? Is it better to wake up at the crack of dawn or earlier to squeeze in a sweet season? Or should you push yourself to extend your long day another 30 to 60 minutes? Both morning and evening exercise have health benefits and potential pitfalls. But for the most people, the right time to exercise is not about how many calories you burn or how much weight you lift. It's more about how you feel when exercising and how exercise fits in your daily schedule. Let's get this out of the first way. The best time to work out is whenever you can. We don't all have shows that allow us 90 minutes workout, green smoothies with collagen, and a 20-minute session with Theragen. If you only have time of the day to exercise before work, then the morning is the best. If you receive physical activity for packed evening, there's a good chance you won't ever get it to it. Likewise, if you can only squash 20 minutes of exercises into your day right before you get ready for bed, that's the best time to work out. Children and adults from age 5 to 17 years old should do at least 60 minutes of moderate to vigorous intensity physical activity daily. Physical activity of amounts greater than 60 minutes daily will provide additional health benefits. Should include activities that strengthen muscle and bone at least 3 times per week. Adults aged from 18 years old to 64 years should do at least 150 minutes of moderate intensity physical activity throughout the week, or at least 75 minutes of vigorous intensity physical activity throughout the week, or an equivalent combination of moderate and vigorous intensity activity. For additional health benefits, adults should increase their moderate intensity physical activity to 300 minutes per week. Adults with age 65 years and above should do at least 150 minutes of moderate intensity physical activity throughout the week, or at least 75 minutes of vigorous intensity physical activity throughout the week, or an equivalent combination of moderate and vigorous intensity activity. For additional health benefits, they should increase moderate intensity physical activity to 300 minutes per week. Those with poor mobility should perform physical activity to enhance balance and prevent falls 3 or more days per week. The intensity of different forms of physical activity varies between different people. In order to be beneficial for cardiorespiratory health, all activities should be performed in bouts of at least 10 minutes duration. Your support and activity affect us to become a channel as big as and profitable as possible for everyone. So be a part of it and be active. Together we can do it.